Tim, let's talk about what goes wrong with the thumb. Is it the base of the thumb or the top of the thumb? When you say thumb injuries, what are you talking about?
Two of the most common things, trigger thumbs. So any trigger finger is soreness in through here. And patients will come in either it's triggering and locking and catching on them, or just by gripping and grasping, which is how it's pretty much caused. They're getting a lot of pain. That's an easy fix. And
How's it an easy fix? What do you do?
I don't like medicine, and I don't like shots, but that is the one thing I've had myself. I ended up having someone give me a shot, gone. So you can get rid of that with a simple shot. CMC arthritis is probably the second most common thing I see in the thumb.
You say CMC arthritis, what are you talking about?
So yeah, the carpal, which is the wrist bones, metacarpal, the thumb bone, or the bones in the hand. That joint right there, 1 out of 4 women have an arthritic problem with that.
Why do they have that?
Some guess it might be just ligamentous laxity. They're more ligamentous lax, or their joints move a little easier than ours.
And what problem occurs?
So the joint is basically 2 saddles facing yourself. So unlike any other joint in the hand, this joint actually has 3 planes of motion. So it's got a lot of chance to slide around. It's also in charge of pinch. So in order to have a firm pinch or grasp, this has to be stable. So over time, that can slide around, and if you're more ligamentously lax, it gives it a little bit more leeway, and it'll start to rub incorrectly, rub the cartilage off, which is arthritis. So arth means a joint, itis, inflammation. Rub that soft surface off, or that bearing, the joint surface. It'll start to get to bone on bone. The bone sees the increased friction and stress. It creates bone spurs, because that's just the bone trying to create more support, and that's where they get the cracking and the soreness.
What do you do for it?
First time, just make sure that what we have is arthritis, so I'll take an x-ray. Oftentimes, I'll get them started in a tether brace. There's different types. My thought on this is the more rigid the brace, the less frequent the patient will wear it. So we try and find a brace that is going to work best with the patient and their activities. Let's face it, people are active. They want to keep using their hands, or they wouldn't come see me. If it needs a shot, I'll put a cortisone shot in there. It'll settle it down. That's not a fix. But good literature supports 54% of the time. Just good activity modification, a good splint, and some injections here and there will stave off any type of surgery. But to be honest, the reason I went into hand surgery was this surgery. I love it. When I was in residency, patients feel like it gives them their life back.
So what do you do in the surgery? What do you do?
Been written up all different ways. I have my way that I learned in my own fellowship. But the bare bones of it is there's an incision over the thumb. You remove the arthritic bone, and I know that sounds odd, but that is the arthroplasty part. Arthroplasty just means changing the joint surface. So I remove that bone, and then I'll reconstruct the ligament that's stretched out, and that's called a suspensionplasty. And I use a spare part from the patient, so there's no metal or plastic. Because I think if you look at how hand surgeons have done this over years, and you look at hand surgeons in general, we like to use the patient's tendon to reconstruct the ligament and not put anything in there, because it's a really complex joint and they tend to wear out. So
what kind of results do you get with it?
Excellent. It's actually a great surgery. The patients have about 5 weeks in a cast, and that's really the downside. Then we get them moving in therapy. Generally, they're doing most of it on their own. By 10 weeks, I want them strengthening. By the 4-month mark, they're back to playing golf and normal activities. So it's a great surgery. It is a bit of a downtime. It's not a quickie like a carpal tunnel release or a trigger finger release where you're moving immediately. But it truly does give you back your activities.
When we talk about joint replacement, we frequently think of knee joint replacement and hip joint replacement. Can you replace some joints in the fingers? Tell me about it.
You can. So traditionally, a doctor named Swanson, way back when in Michigan, came up with putting in silicone implants. Great, they're perfect, they do really good for pain relief. However, they have been shown, Mayo Clinic had a great study. They only give you, anywhere from 5 to 10 years of longevity, and then they'll start to break. So there have been implants created for these joints specifically, and in the knuckles here, that will give you a little more longevity. In fact, a lot more longevity. And some of them are made of pyrocarbonate, and some of them do have a plastic, basically insert inside. Mm-hmm. What that allows you to do is actually start motion a lot sooner, but only certain patients, ones that don't have gross instability or a lot of deformity, those patients aren't good candidates for that. They'll end up getting unstable. But for a patient that remains active and just has true degenerative arthritis, they're fantastic.